Hi, this is Frank Senecal. I'm one of the medical oncologists with Northwest Medical Specialties, and it's my pleasure to talk to you a little bit about COVID. Um, Kind of a tough and scary topic these days, but we want to address this and let all our patients know kind of what our guidelines are and what our suggestions are. Um, as all of you know, it's been a dreadful period of time since really February of 2020. Um, so many patients affected by COVID and so many deaths around our country. We're fortunate, I think, in Washington that there's a great deal of concern about this, and certain safeguards have been implemented by the governor that I think have saved lives. But still, there's a great deal that we need to personally do in order to try to reduce our risk. And really, the vast majority of our patients, most of you, have issues associated with your immune system, either because of an immunological disease or a hematological disease, a bloodborne disease, or perhaps cancer, and treatments associated with that that can increase your risk of contracting the virus or having a more difficult time if you should get the virus. I want to reemphasize those factors that you keep hearing over and over again about social distancing, remaining 6 or 8 feet between individuals, that you mask if you're outside your home, wear a mask to protect you from contracting the virus, but also protect others from you if you should be carrying the virus and not know it. So these are still key factors that need to be considered. Personally, I enjoy going to church on Sunday, but we've had to be very restrictive about church going, very restrictive about parties. I have 5 kids and 5 grandchildren, and we've had to be very conscious of exposure. You know, it's not just exposure to that individual child or grandchild that's the issue, but that individual brings with them that history of exposure during the past few weeks. So although they may not have any symptoms, they can be carrying the virus and easily shed that virus in the environment and have you end up getting ill um, completely without any intent at all, of course. Um, but there's risk, particularly with our close family members that haven't been able to be secluded at their home because of work responsibilities, school responsibilities, etc. So I ask you to be really, really cautious about social distancing, about wearing a mask out in public when you go outside, even if it's to go outside for a walk. And then be really careful about your family members. Make sure you ask them if they've been just as careful as you have been. You'll also notice that our clinics that we take certain precautions, and this is really true at all healthcare organizations, the hospitals, whether it's Good Sam or St. Joe's or St. Clair, St. Anthony's, Multicare, any of the hospitals that we attend, you'll find that you need to get assessed, that you need to get your temperature taken. There will be questions regarding what your symptoms might be. Have you had any fever? Have you had any congestion, sore throat, shortness of breath, etc.? Any of those symptoms that might be associated with COVID. So just be prepared for that. I know in our Puyallup office that many times patients are actually met as they're coming in or in their car to be queried or questions regarding these things. And please just kind of accept that as one of our safety precautions. We have to be really cautious about people coming in that might be carrying the virus. We don't want our patients to get exposed in the clinic to the virus. So we have to be very cautious about that. As you know, there are several different tests now that are available to see if the patient has the virus. If you're suspicious that you have symptoms, you can call into our offices. We have the capability of doing testing. And for most of our patients, we would want to do that testing if you're beginning to develop any symptoms. So be aware of that. Finally, I just wanted to make some comments about the vaccine that the two vaccines that are becoming available, and now there's a third that will become available in a bit from England. These vaccines look very effective. The most effective vaccine that exists is probably the measles vaccine. It's almost 99% effective. These are about 94 to 95% effective. So we're convinced that they really work. Many of our patients would be good candidates for these vaccines. There's generally concern about giving the vaccine if somebody has a history of drug reactions, anaphylactic or serious allergic reactions to medications. So if that's true, you want to make sure you convey that to the administrators of the vaccine ahead of time so that they know that. In some cases, it's safest not to get the vaccine if you're in that small group. I want you to talk to your healthcare provider, your hematologist or oncologist, regarding the vaccine. If you are immunosuppressed at a certain time during your treatment, for example, if you're getting chemotherapy and your white blood cell count is down temporarily, it may be best to wait until the white count comes up and is returned to a more normal level to hope that the vaccine will be more effective for you. We have some patients that are stem cell transplant patients, for example, that can get the vaccine, but we typically check their immunity ahead of time to make sure that they can react to the vaccine adequately. For those of you who aren't on current therapy, aren't on, for example, chemotherapy, then it's a little bit simpler. Most of our patients, we believe, would respond to the vaccine, and the vaccine would be safe for them. So best thing to do is when you see your doctor, discuss with them if you need to take any special precautions regarding the vaccine, if your blood count should be checked ahead of time to see if it's in a range that a response to the vaccine, a protective response, can be expected. The vaccine, I think, is safe. We're going to get more information about safety over the next few months. It is true that there could be side effects or toxicities that develop over time. We think that the likelihood of that with the technology that's used is very, very remote, but there is that possibility. If you're healthy and your immune system is quite strong at this point, you may decide that you want to wait until the vaccine becomes more readily available, for example, till March or April, something such as that. By that time, I'm certain that there will be more safety information available. But for most of our patients, we'd encourage the vaccine at this point and think it'll be a benefit for you. So talk to your physician, see what the right timing of taking the vaccine would be, and review that history of allergies that you may have had in the past and convey that to your doctor. In terms of sites where the vaccine will be available, we're going to get more information about that. Certainly, if our site is selected, then we'll make sure that you're aware that we can provide the vaccine. If it ends up being at Fred Meyer or at one of the pharmacies such as Walgreens, then I think we'll all be hearing that in the near future and be able to call and sign up to receive the vaccine. So those were the key points that I wanted to address to you. We have to continue to be careful about our exposure. Even after you receive the first vaccine, it's not completely protective. It takes time for the vaccine to kick in. By the time you get the second vaccine, a few weeks after the second vaccine, it looks as if protection will be available for you and that you'll be protected from getting the virus. I would still recommend that you practice social distancing and that you use a mask after you get the vaccine. Again, this is simply because the incidence of the virus is so dominant in our community. There are so many people that have it. And particularly in our patients that have been immune suppressed or recently had received chemotherapy, we don't really have any good data to tell us about the effectiveness of the vaccine. So if you're on active treatment and your immune system is suppressed for any reason, either treatment or because of the disease, very important for you to continue to practice social distancing and wear a mask and protect yourself. So those were the key points I wanted to make. Wish you all the best and be safe. Take care of yourself. Wish you all a happy new year. My very best to you. Take care. Bye-bye.